Good afternoon, everybody. I'm Jody Hanson. I'm Director of Communications for Johnson County Government. Thank you for your patience as we worked through a few technical difficulties. With us today is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is our Director of Epidemiology. And then we have a special guest with us today. Dr. Jennifer Watts is with us. Thank you so much for being here. She's the Medical Director for Emergency Management at Children's Mercy. So we will go ahead and get started with some opening remarks. Just as a reminder, on Thursdays, we do a press conference format. So we're going to take some questions from the media, and we will try to take some from Facebook if we can. Dr. Ariola, please let us know how today's clinics went and plans for next week.
Thank you, Jody. Good afternoon, everyone. And first of all, I would like to welcome our good friend and partner in the response to COVID, especially right now that we are vaccinating. Dr. Jen Watts, she has stood very tall along with colleagues at Children's Mercy Hospital. So thank you for joining us. Today we did run our clinic at Oakland Fieldhouse, largely for second doses, and we vaccinated 1,266 residents today, and that's the plan again tomorrow. We have slightly over 1,300 persons that are due their second dose tomorrow at Oakland Fieldhouse, and the clinic will run there from 9 to 1. Next week, as we have shared, we are extending our hours at our new location in Lenexa. And Tuesday, Wednesday, and Thursday, we are planning to vaccinate 3,000 residents each of those days, and then also have an appointment open on Friday for second doses, as well as appointment open on Saturday for first doses. So collectively, we are going to be doing more than 10,500 vaccinations next week. Now, last time I checked, the appointments for Tuesday and Saturday were filled up, but still a few appointments left for Wednesday and Thursday next week. And as we have been mentioning, we are using a different appointment booking system. And so if you have completed the online vaccine interest survey, we're reaching out to those on our list. And we also include this time around a way for you to let us know that you have been vaccinated elsewhere. So that's something we couldn't do before. So we're working through that. Please check your junk folder in your emails. And we are also having a staff call people to help them with registrations and reaching out to people also via text. So again, we are working through that, and that the plan for next week is really what we are hoping to replicate for the next few weeks with more vaccines coming into the county. And so that's the plan for next week. But I really do want us to spend time. Elizabeth has worked very well with Dr. Watts and their team. And I have been a couple of times to those locations and just how effective, how efficient those operations are running, and how well you took up, along with your partners at Children's Mercy, Dr. Watts, even from the beginning when we are planning for responding to this, engaging our schools, and your team taking the lead. Again, very happy that you're joining us. Now I'm going to take a back seat and let you and Elizabeth go through what you have done the past several weeks regarding keeping our schools safe. Dr. Watts.
Thank you, and thanks for having me. It's been a remarkable collaboration. We started at the beginning of February. Children's Mercy, Johnson County Health Department, and the school districts and child care providers across the county. We, at Children's, we started like the rest of the hospitals, and we vaccinated our employees, all of our healthcare staff. And once we had finished with that, we really were not, we don't treat the populations that were eligible for vaccines. So we felt it was important to continue to give to the community where we could, where we are eligible vaccine providers. and serve those groups that do provide childcare services that do help with our population. Naturally, that includes our teachers and our childcare providers. And so this collaboration grew from that interest, and it's been an amazing collaboration. We started back in February. We just finished our last clinic this past Tuesday. We did just over 30,000 vaccines, 15,000 first doses and 15,000 second doses. We had about a 98% completion rate of those that got first doses that came back and received second doses. And overall, we found we had about 70 to 75% of the teachers in the county come through these clinics. So quite a big lift for sure. But I will tell you, it was also quite fun to collaborate with everybody. And the clinics were just, they were a lot of fun to be at. We took a team of about 50 people, I want to say, from Children's Mercy, every clinic we did. The county, worked with our school districts to help tier their employees. So as vaccine became eligible, we were not targeting one area in like one district, but we targeted the highest risk across the county. And so they were tiered internally. Each district tiered their own people. And that allowed us to target the highest risk first in order to, decrease the quarantines as possible and so forth. We did host clinics at 3 of the largest districts. We hosted clinics. We started at Olathe Northwest. We moved to Blue Valley at the Hilltop campus, and then we finished at Shawnee Mission Center for Academic Achievement. We ran all of those clinics through there. And we had staff, we had school nurses vaccinating along with us. We had our pharmacy on site. We took vaccine in with us. We drew vaccine up on site. We administered everything on site. We did all of our observation, obviously. And it was just a great collaboration to see so many people get vaccinated. I will say it's been very rewarding for us because we know how hard the schools have worked this year to really keep the kids in school, to get them in school, and then to keep them in school. So they've done a lot of work to make that possible. And, getting the vaccine and, actually providing that vaccine opportunity for them was just kind of icing on the cake for us, because this group of individuals, the teachers, the childcare providers, they've done so much for our children in the county that it's allowed people like me to continue working. It's allowed our hospital to keep functioning because a lot of our hospital workers do have children in childcare or in school. And it also allows our kids to keep going to school and, gain from all the benefits of being in school besides education. So it's been a phenomenal collaboration for us. And we actually were kind of sad to end, but we've really enjoyed doing it.
And thank you, Dr. Watson, the person who has been at the heart of this for us, who has taken the lead and facilitated, at least once I got here, my conversations with you and relationship with you is Elizabeth. And before the vaccination, there was a lot of things that was going on. We prioritized schools. Elizabeth attended several of the meetings with the school district. So if you would take it from there, just describe our efforts, and we're pretty happy about where we are with the vaccinations.
Yeah, absolutely. Thank you, Dr. Ariola. And really, Dr. Watts has been a tremendous partner. Children's Mercy has been a tremendous partner. It's been a really long journey. I remember being in the initial conversations last March when we were starting to have our first couple of cases, and the decision was made to go remote for the school districts. And then the governor came out and announced it. And, over the summer, we worked really closely with Children's Mercy. They are the leading experts in children's health here. And so when we started looking at how to bring kids back into school, when we were really struggling to have gating criteria or some kind of guidance for how to do that, Dr. Watts and her colleagues over at Children's Mercy were incredible resources to bounce ideas off of, to hear what they believed based on the science and the research in kids. And it was really that collaboration was begun then. And we showed them our gating criteria. They gave us feedback. We talked about our quarantine guidance. And as you know, at the beginning of the school year, we were really pushing to get kids back in a way that we didn't see a lot of districts throughout the country doing. And it was because of that partnership, because we had those experts at Children's Mercy telling us that they too believed that it could be done just as we did, and we could do it safely with certain measures in place. So Dr. Watts and I began speaking last fall about testing capacity and over the summer, because we didn't have a lot of testing in kids. And if we were going to open up schools, we knew that that was a needed piece. And so excellent partners, they did drive-through clinics through Children's Mercy Kansas and at their urgent cares, and allowed for us to identify cases so that we could keep our schools open, so we could prevent transmission, which was what we needed to do. We knew that we would have cases in our schools, but the important piece was that we didn't allow it to be transmitted. And a big piece of that is early identification of sick kids. And so again, a key partner in being able to do testing in the population. And then as we started moving through and we saw the big increases of cases, additional conversations were being had about what is safe, what should we do, and just really great partners with a ton of experience and expertise. And then we got to really work together as vaccines started rolling out. Again, Johnson County Department of Health and Environment, Children's Mercy, we've been huge proponents of doing whatever we could to keep kids in school, because we do understand the importance of it. And so it became very obvious to us that we really needed to be vaccinating these teachers. So as Dr. Watts said, we started with our highest risk, looking at SPED teachers, special education teachers, because a lot of times those children can't mask, or maybe the teachers can't mask because they need to be interacting face-to-face with those students. And so we started there after immunizing the school nurses. And, it has been a tremendous lift trying to orchestrate 6 public school districts, a couple or about 100 to 200 private schools, and about 600 to 800 childcare centers and homes. It's been a tremendous lift, but Dr. Watts and her team, it's been incredible to see. They run it very differently than our clinic, but just brilliant the way that they were able to move staff through and vaccinate these individuals and observe and just do all of those pieces. And also, frankly, the leadership of Dr. Ariola to dedicate doses early on to school staff, even before Governor Kelly came out. And then Governor Kelly came out and added more vaccines to our pool to be able to immunize these individuals, which means that we were able to get through 15,000 staff in fairly short order, much quicker than a lot of our counterparts with much smaller school districts. So again, just tremendous partnership. I don't have enough words to express how grateful I am. There's no way we could have done this without Dr. Watts, without her team, because we've also been able to vaccinate our community. So we didn't have to take our vaccinators out. We didn't have to take our staff to go do these clinics. It was really Dr. Watts. It was the public school districts, those 3 districts in particular, the Blue Valley, Olathe, and Shawnee Mission, providing locations for us to vaccinate. All of this, just a lot of partnerships. And I'm thrilled that we've been able to do it. And I look forward to continued collaboration even after we get out of COVID.
Thank you, Elizabeth. And it's look, the way that we wanted to approach this from the start, we understood that we are a large county, and trying to vaccinate all of our eligible residents, 475,000 of them, through 1 or 2 clinics was not going to work. It was going to take us a long time. And there's a reason why we refer to it as local public health systems. It's bigger than the local health department. It includes all of our health systems, and just our health systems picking up a huge portion of the response, including Dr. Watts and our team. I think it's why we're where we are. We are looking at the numbers. We like to vaccinate more. We have a long way to go, but we're making some progress. And I know we don't want to go there yet, and we won't. But Dr. Watts and our team are not done yet. There are plans in place for them to continue to vaccinate, and we'll be talking about those as time permits. So Jody, I guess time to take some questions here.
Yeah. I just want to say this, I really enjoyed, this was good information, such a great partnership. I can remember seeing some of the social media at one of your clinics where people were tweeting about, wow, this went so well, it went so fast, just being so pleased about it. And those numbers are very impressive. So, and just the other thing I wanted to say, I just remember the first time I heard Elizabeth talk about you choosing to vaccinate because you couldn't vaccinate the people that you serve. So you wanted to vaccinate those that care for those kids all day. And just what a great sentiment and just what a great service to the community. So thank you. We will take some questions that we've got. We've got a couple of reporters with us. We have Sheree Honeycutt, who is with Fox 4, has a couple questions. So if we could go ahead and unmute her, we will have her ask her questions.
Hello, can you hear me?
Yes.
Hi, Dr. Ariola. I have a few questions for you. You talked a little bit about your clinics, and I wanted to know a little bit more about how you guys are expanding your vaccination efforts throughout the county. Can you go into a little bit more detail of what that will involve and what you're planning for the future, please?
Thank you. Happy to do that. And so early on, just expanding on what I was saying, we were pretty clear about what we think is the most efficient path to getting our residents vaccinated as quickly as we can. And that has to be bigger than us opening up one or two clinics. No matter how well you run those clinics, there's just so much you can do. And so for us, expanding what has been around 7,000 vaccinations a week to 10,000, 11,000, that's a lot of vaccinations to get through every week. And that includes, of course, first and second doses. But our approach was bigger than that to start with. We were thinking way ahead of when we were getting 2,000, 3,000 doses. We were planning for when we are getting 25,000, 30,000. And I think the beauty is what we are seeing. And that includes involving all of our health systems. So Children Mercy, we've got Dr. Watts here today. We've got KU Med, we've got Olathe Health, Advent, we've got St. Luke's, we've got Overland Park, Regional, and Menorah. All of them are vaccinating. We had a meeting yesterday, our weekly meetings, really re-emphasizing a lot of what we have been talking about. Every one of us, every one of them, just like we are able to expand, have been able to expand really tremendously to the extent to which when people ask me, what if you are getting 30,000 doses a week? Are you able to handle that? And I think the answer is yes. Can we sustain that for 3 months? Maybe not. But for the next few weeks, we feel very confident based on that. Olathe is expanding. KU Med is expanding tremendously. Advent, some weeks will give out 5,000 doses in a week. Dr. Watts and our team, we've seen weekends where they've given out about the same amount. So that's that. In addition to that, our pharmacies are expanding their operations. I spoke with two of them last week, Walmart and Hy-Vee, and both of them are expanding. One of them was expanding from 7 stores that are currently vaccinating to 11. The other was expanding to all 6 of their stores in the county. And not just expanding to these locations, they are increasing the number of doses that they're giving out daily. This week alone, we have worked with several providers in the county. We have worked with a team of pharmacists also in the county that are going to be vaccinating 500 persons a day. So we're working with private providers. The state is now sending us doses to send to private physicians to vaccinate their patients. We are sending that. We have teams that contacted every one of those that are registered with the KDHE as providers, and we're getting information about how many they can handle a week and making arrangements to ship that to them. We have been working with Heart to Heart is setting up a clinic on Saturday to vaccinate our utility workers. We've talked about efforts that we've done with Health Partnership, who is also vaccinating. We talked about so many other partnerships with Salvation Army and others. We work with our health systems to vaccinate our residents in higher educational institutions. So it's that level of collaboration, it's that level of cooperation that really has allowed us to get to this far. We are now getting 18,720 doses a week. That's 2.5 times what we were getting 5-6 weeks ago. And the demand is very high. And so we welcome that, and we welcome even more. We're going to need that effort to quickly vaccinate our residents. The one thing for our county really, which has been very impressive, is the interest. The uptake for the vaccine remains very, very high. People want to take it. Of course, we are monitoring what's going on across the state, across the country, and it's not like that everywhere. So we're very happy to have the problem. The problem we have is we just don't have enough vaccines to give to our people. The interest is high, and we're hoping that that interest remains. And as long as it remains, we're going to continue to look for different ways. We want many providers in the county. We want many channels through which our residents can get the vaccine. Again, for us, 30, 40, 50 channels is a lot better than 1, 2, or 3. And also, one thing to emphasize, it is easier for me to go to Dr. Watts if I have a relationship with Dr. Watts. If I'm taking my child to her, it's easier for me to go there than to come to one or two clinics. And I think that's what reflecting in the interest and the numbers. And I should also remember the efforts that we have put into independent living facilities, as well as long-term care facilities. We have worked with pharmacy groups to go to take vaccines into these facilities. We started with 27 of those independent living facilities. But even beyond that, what people have not followed is after the initial federal pharmacy partnership program, there are new residents and others that need vaccination in our long-term care facilities that we have had to make arrangements for to get them vaccinated. So it's really a lot of relationships, a lot of collaborations that's going on that's letting us vaccinate. And lastly, I should mention the collaboration with Josh Powers and our transit authority, bringing our residents who need help with transportation to our clinics. Now we are having transportation clinics on Thursdays, and we have a team who, by the way, is trying to do 50 vaccinations this week that are taking vaccines to our homebound residents and taking vaccines. And I think as at last week, we've done about 92 of those. And this week, the plan was to do 50. And so there's a lot of things going on simultaneously just to get the vaccine into as many hands as possible.
That's wonderful. And so I have two other questions, but I'm going to kind of roll them into one so I don't take up everyone's time. So it sounds like you are getting thousands and thousands of vaccines to people all the time. When do you see vaccines being available to a wider range of people, including young people? And how does it make you feel to be able to get these vaccines to younger people and people throughout the county?
Well, so if it's okay, I'll take the last question first. Makes me feel really good. I saw Dr. Watts, I saw Elizabeth laughing. We were smiling. We want everyone who is eligible for the vaccine to get vaccinated. We also know that we just got recently some feedback, which I know that Chiremasu were part of, trials for vaccinating adolescents between 12 and 15, producing promising results. So we are also looking forward to when the vaccine is approved for that age category. So we want the vaccine in as many arms as possible in our county and across the state. Now, the first part of your question is, look, everyone, right now, the governor's opened up vaccination to every phase. The need for the original prioritization was strictly because we just did not have enough vaccine. And so there's got to be a way to prioritize that. But also, in addition, the logistics, ramping up the logistics, bringing in the bodies, the locations, and different things, those took time. And so we started off by ensuring that our most vulnerable population are prioritized. So we prioritize 65 plus, and within that, we prioritize 80 plus. And you can see the impact of those in our numbers, our death numbers, hospitalization, those have gone way down, and that's a good thing. I was talking to Elizabeth earlier today on how we need to even look into opportunities to prioritize based on age, even moving forward. And we also had some very targeted vaccinations to our other vulnerable population, those who live in congregate settings, intellectual and developmentally disabled population. All of those we did while we are vaccinating in 65 plus category. However, our goal towards the so-called herd immunity, population immunity, is based on getting 70, 80, 85%, maybe 90% of our population vaccinated. And our path towards that is now going to be narrow. It's got to be broad, and we have to vaccinate broadly. But right now, those opening up vaccination for everyone through phase 5 means that if you are 16 plus in the county, you are eligible for the vaccine, and that's a good thing. Now, it might mean that those who are 50, 55 maybe need to wait slightly longer, but for us, it just fits into what we're trying to do, make everyone eligible and vaccinate as quickly as we can. Again, vaccination is not just based on throughput in the clinics that the Department of Health and Environment runs. It is what Children's Mercy is doing. It is what all of our health systems are doing. It is what the pharmacists are doing. And collectively as a county, we are vaccinating a lot of people every week.
Wonderful. Thank you so much.
We have a question from Jackson at KMBC, and I'm just going to go ahead and read his. Approximately how many Johnson County residents have been vaccinated, first and second dose?
You want me to go ahead and take this, Dr. Ariola?
Please do.
So we presented some of this data this morning to our Board of County Commissioners. You can also find it on our website. Based on data that it was provided by KDHE to us, they have that we have about 85,000 Johnson County residents who are fully immunized, and then about 153,000 first doses have been administered. There was a new release from CDC today with county level data, and it actually shows that our number is substantially higher than that. We're still investigating. Our suspicion is it contains information about residents of ours who were vaccinated in other states, which are not being fed to Kansas's, the state health department here in Kansas. And according to CDC's website, it actually says that we have 119,000 Johnson County residents who are fully immunized at this point, putting us at about 1 in 5 of our residents are fully vaccinated. So we'll continue to dig into the differences in those data and figure out where those are coming from. But either way, we've done a tremendous job. We have one of the highest vaccination rates in the metro area. And I think, again, to Dr. Ariola's point from earlier, it is truly because of the partnership of the global public health system in Johnson County, the hospitals, the pharmacies, other providers, Children's Mercy. So I think we're doing really well, a long way to go, but certainly have made huge strides since vaccine was rolled out at the end of December.
We have a few questions that were submitted by reporter Kaylee McLaughlin with the Shawnee Mission Post, who couldn't join us today. First, what is the official guidance for religious activities as spring holidays either continue or start? What does JCDHE hope people will do to celebrate their respective holidays?
So the vaccination is a tool that we welcome. It's very rare that in a spate of 1 year dealing with a novel virus that will have 3 vaccines that are approved in the United States, and globally there are other vaccines that are in use also, even beyond the 3 that are approved here. However, we know enough about the spread of the virus to know that we have a long way to go. We know the virus loves the indoor environment. It loves when people interact, and so we're not quite out of the woods yet. We have described this as a long tunnel. We are beginning to see some flicker of light, but we have a long way to go. It is not the time to take steps that will cause us to lose the gains that we have made. People have to understand that we got to where we are because our residents were doing the right things. They were wearing masks even before we started vaccinating. They were avoiding large gatherings. They were keeping their cycle small. And those things will have to continue. And across the country, and even for us, we're beginning to see the number of cases, positivity rate, incidence rate flatten or begin to creep up. Part of that, of course, is that some of the more predominant strains are for now is becoming the UK variant, the B117, and there are other strains that are circulating also, and so we do need to keep doing what we're doing, and so there is the new CDC recommendation, but even that people. We have to interpret it like it's intended to be, which is fully vaccinated people can interact, and if we are interacting with people that are not vaccinated, with one household, it says, but even that has to be somebody who doesn't live with a high risk person. So going to a church when you don't really know the vaccination status of others in a big environment, you as long as there's physical distancing and the ventilation is good and you wear mask and all of those steps, those continues to be our recommendation. There is nothing in our order in anything that prevents any of those activities. But we are going to continue to educate our residents as to what the risks are involved, the risks that are involved. There's no question that we got to where we are because we acted together collectively out of a sense of responsibility, not just to ourselves, but to our fellow residents, and that has to continue. There's nothing that stops people from taking on their religious activities. I do the same. We just have to remain committed to those goals. We're not out of the woods yet. We need to be careful. If I see an indoor gathering that is large, I will be very nervous. If it's well spaced out and it's an outdoor environment, that's great. Outdoor, the weather they are our friends right now. So if I can have a gathering outdoor and do things outdoor, that would be my preference while I'm wearing masks. Look, where we work, we've all been vaccinated for a while. And I know that even for us, as we even attempt to take steps back to do things, it's challenging because we know the risk that's associated with the virus. So my message to people is continue to be careful. We have a long way to go. We've made some progress. Let's not lose the gains that we have made.
Thank you. She had another question, and she'd just like you to underscore why it's important to receive the vaccine. Why is it good for the community to get as many people vaccinated as possible?
Is it okay if I let Dr. Watts take this? She can't just be quiet. She's been quiet for a long time. Go ahead. We do the same thing, so she'll take that.
I think we have data that shows that the vaccine is pretty effective for serious illness, and even quite effective for mild illness too. But with the scientific data out there that supports it, it's important for everybody that can possibly get it to receive it. It not only protects you from serious illness, including death, but it also protects everybody around you too. And coming from the pediatric population, I will throw the child slant onto it as kids are not eligible yet to receive vaccine. Kids do still get sick from COVID. Kids still do have problems from COVID-19 as well. And so until everybody has an opportunity to receive vaccine, it is our responsibility as a citizen, as somebody in the environment, in the public, to receive that vaccine when you are eligible, if at all possible. So we can continue to protect yourselves and continue to protect everybody around you, including the children that are just not yet eligible.
And then we just have a few more questions, and this is from the same person, and we'll, if we could just maybe, I'll try to summarize them. This person's a viewer, but doesn't have a Facebook account, but has some questions about the federal retail pharmacy program. This person knows that pharmacies get their allocation from the federal government, but does the state or county have input in the allocations? This viewer uses the Vaccine Spotter website and sees appointments throughout Kansas, but not in our area. So just wanted some detail on that as far as who's offering it. So any detail you can give on that program, and then we'll wrap up for today.
Elizabeth, you take that.
So the viewer is absolutely right. The federal government does allocate those doses to the pharmacies. And neither the state nor the county have any influence on how many doses are allocated, although at least prior to us opening up to phase 5, Kansas did implement sort of structure around who they could vaccinate. I would say that probably the reason why you're able to see these vaccine appointments available in other parts of Kansas, but not in our area, is really just about supply and demand. Some of our more rural counties have been able to vaccinate a higher percentage of their residents because of the way that the doses were allocated and their uptake. But I think for the most part, the majority of people in rural Kansas seem to have been vaccinated, at least in the earlier phases. So if you can drive, if you have means of traveling to these areas, absolutely feel free to do that. There's nothing stopping you either from going to Missouri or from going to other parts of Kansas or to other health departments. But I will say that, in Johnson County, which is amazing, we have a really high demand for the vaccine. We have a lot of residents who want it. We have a very large population. So at this point, if you're a Johnson County resident, you're still interested, I will do the plug to please go on, if you have not filled out our survey, to jocogov.org/interest survey. And if you want an email confirmation after you fill it out, please make sure you put your email in on that last page so that you do get that email confirmation. And also continue to use those websites, Vaccine Spotter, or check other health departments in the area and see if there's a possibility. But we have a lot of residents here and they're very interested in getting the vaccine, and we're very interested in giving it to them. Unfortunately, vaccine supply is still not meeting the demand for our community.
But we're getting closer, right?
And doses are increasing. And, hopefully in a few weeks, we may see an increase in Johnson & Johnson, which will be excellent for us as a single dose vaccine. So we are getting closer. I think every step of this vaccine rollout, as Dr. Ariola said, it's the flicker of the light at the end of the tunnel. I think it's getting a little brighter. So hold on for a little longer. And I think pretty soon we'll be able to get everybody who wants a dose.
Great information today. Dr. Watts, thank you so much for joining us today. It was great to have you here. Dr. Ariola and Elizabeth, as always, thanks for the great information. Nicole, thank you for being our ASL interpreter. We appreciate you. Thanks to the media that attended and asked questions or submitted them in writing, and those that watched on Facebook. We appreciate everybody's engagement on this topic. So thank you so much and enjoy the rest of your day.